Hello, I'm Lawrence Wagman, the Executive Medical Director at the Center for Cancer Prevention and Treatment at St. Joseph Hospital. I'm also a surgical oncologist and for many years have been a cancer researcher. Research in cancer is what makes progress. Research comes in many forms. Some of us know about the biggest studies that have really changed the way we've done cancer treatment, the changes that we've seen in the way we treat breast cancer, how we've reduced the amount of surgery that we do, added in different chemotherapy drugs, and ultimately made our patients live longer and live better. You may not think of a community hospital as a research center, but the Center for Cancer Prevention and Treatment at St. Joseph is a research center. In our research department, all the members of our cancer center have committed to participate in research. That includes our doctors, our nurses, our dietitians, our social workers, our schedulers, our clinic aides. Everybody is committed to the research project. Why? Because they recognize the benefit of research. 2 research projects that were recently completed at the Center for Cancer Prevention and Treatment included a way to make sure that women get their mammogram and their clinic appointment in the time that it should be done and not miss things because of unavailability. Another key project that just completed was looking at our intraoperative radiation therapy program. We were the first center in Orange County to use electron beam radiation therapy as an intraoperative treatment for breast cancer. We knew that to be certain that this was the right treatment and it had the same outcomes as standard radiation, which comes after the operation and is done in a technique called external beam radiation therapy, we had to do research to study. What we did is we recently compared the radiation therapy treatments that were given as external beam, that would be 6 weeks of radiation or 3 weeks of radiation given after the operation, to the single dose of radiation given during the surgery. I want you to think about that for just a second. Coming 5 days a week for 3 weeks or 5 days a week for 6 weeks, compared to having your operation and your radiation done while you're under anesthesia at one time. I don't have to explain the time value, but we also needed to be sure that the treatment wasn't causing more harm or giving an outcome in the way the breast looked that wasn't equivalent. So we did research. We carefully collected all the information about the operations and about the radiation, and then we compared them to be absolutely accurate and confident in our reports. And what we found is that a single dose of radiation compared to giving radiation for 3 weeks or 6 weeks was either absolutely equivalent or superior, both in side effects and the way the breast looked, or what we call the cosmetic outcome. This is research done here at our community hospital and available for people around the country and, frankly, around the world. These are not just innovative, but they really change the course of patient care and the satisfaction for patients with their treatment. We do other very complex studies also. We test new drugs, we test how they work, we test their side effects. We do things to make people live longer and live better. Research needs to be done with precision and accuracy. That's the only way we can really count on the results. Our team makes sure that when we collect data, it's accurate. When we share data, it's done very, very carefully. Each year we undergo audits to make sure that we meet the quality criteria of the organizations, the pharmaceutical companies, the national groups that sponsor the research, and invariably, we do extremely well in those audits. For more information about cancer research and how to support cancer research, please call the St. Joseph Hospital Foundation. Thank you.